Okay, so we're going to go ahead and I'm going to start on your head. First thing I want to do is just look at your face. Lauren's eyes are midline, her nose is midline, so is her mouth. And I'm going to feel through her scalp for any lumps or bumps. We're going to look through her scalp as well for any moles, nits, or lice. And turn your head this way. Okay. And I'm going to feel her temporal arteries for any thickening. I'm going to feel her occipital nodes, feel down her cervical chain for any enlarged nodes. I'm going to feel her submaxillary nodes, her submental nodes, her preauricular nodes, her postauricular nodes, anterior cervical, posterior cervical, supraclavicular, and supraclavicular. And your tonsillar nodes. And if you would, Lauren, go ahead and clench your teeth together for me, feeling the masseter muscles. Okay. And let's feel your sinuses. Does that hurt at all? Your frontal sinuses?
No.
And your maxillary sinuses. Any pain?
Nope.
Okay. Okay. And then we're going to go ahead and I'm going to have you smile for me. I'm going to have you raise your eyebrows for me. Can you frown? Okay. Close your eyes. Can you feel this?
Yes.
This?
Yes.
This?
Yes.
This?
Yes.
This?
Yes.
This?
Yes.
Okay. Can you puff out your cheeks? Can you pucker your lips? Okay. Can you sniff in? Nares are patent. No lumps or bumps on the nose. Okay. Laura, I'm going to quick look in your nose. Mucosa is pink. There's some mucus. Everything looks good. Okay. And Lauren, we're going to look in your, take care of your ears. Tympanic membranes are a pearly gray and mobile. Sorry, Lauren.
It's all right.
Try that again. Tympanic membrane is a pearly gray and they're mobile. Okay. All right. I just want to also look at the pinning of your ear. There aren't any lumps or bumps. No lumps or bumps at the tragus. No lumps or bumps at the tragus there. Okay. Lauren, I'm also going to say something in your ear. I'd like you to repeat what I say.
1, 3, 5. 7, 6, 5.
Okay, that's cranial nerve number 8. All right. Okay, we're going to go ahead and we're going to look in at your eyes. first thing I'm going to have you do, Lauren, is cover one of your eyes, and I'm going to have you read the letters that I point to.
O, H, G, F.
Okay, cover your other eye.
A, C, D.
Okay, and you can remove that, and you can read me a line.
The quick brown fox jumped over the lazy red dog.
Thank you. Okay, and then Lauren, if you would, I want you to look at my nose, and just keep looking at my nose. Cover, uncover test is fine. And let's have you. Okay, Lauren. Just look straight ahead. Both pupils are equal and reactive to light. And corneal light reflex is present. And I'm going to look for the red reflex. Red reflex is present. Okay, Lauren, I'm going to ask you to just follow this, okay? Don't move your head, just your eyes. Okay, very good. And close your eyes. Her lashes are nice and full, so are her brows. Lauren, I need to look at the insides of your eyes a little bit. I'm going to look at the conjunctiva is nice and red, and the sclera is clear, and her eyes are brown. Okay, and there was no discharge at all. And Lauren, I'm going to have you do one more thing for me. I want you to cover the same eye that I'm covering, opposite me. Ready? Okay. Now you tell me when you see my tongue depressor.
Now.
Okay.
Now. Now. Now.
Okay. Cover the other eye.
Now. 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 Now.
Okay. And I want you to just look straight ahead, and when I tell you, I want you to look at the tongue depressor. Go ahead. And the pupils constricted. Very good. Okay. Now we're going to look in your mouth. And Lauren, you said that you do not have your tonsils, correct?
Correct.
Okay. I'm looking at her lips. There's a little bit of cracking and dryness present. Mucosa is nice and pink. Go ahead and open your mouth. Very good. And she looks like she has, can you lift your tongue to the roof of your mouth? She has a tight frenulum. Lauren, did anyone ever tell you were a little tongue-tied?
Yes.
Do you have trouble sticking out your tongue? Let me see how far you can stick out your tongue. Okay, not very. Okay, I'm going to look at her cheeks and her gums. Everything looks pretty healthy in here. Lauren, how often do you go to the dentist?
Twice a year.
Okay, and I'd like you to, if you could, open your mouth and say, and there are no tonsils. The uvula is intact. And everything looks good. Let's see if your gag reflex is present. Yes, it is. Okay. All right. Lauren, one more thing. Go ahead and open and close your jaw. Okay. And I don't feel any, do it again, any cracking, no clicking. Everything feels pretty good. You don't have any pain at all in your jaw? No. Okay. All right. I'm going to go ahead and feel your neck. carotid artery is equal on both sides and strong. And I'm going to come around from behind, Lauren. I'm going to feel your thyroid. I'm going to have you look straight ahead. Okay, can you swallow for me? Okay, and now do it again. Okay, and one more time on this side. Very good. Okay, very good. All right. Listen to your carotid arteries. No bruise. Okay, Lauren, and if you would for me, I'd like to see the range of motion of your neck. So I'd like you to extend it back and flex it forward and go from side to side. And then I'd like to just see you turn your range of motion. Very good. Okay, and then I'd like you to shrug your shoulders, push up on my hands with your shoulders. Good girl. Okay. All right, we're going to get you up here on the table. Stop here. Okay, Lauren, I am going to listen to your, I'm going to actually have you turn sideways there so I can, and have you pull up your hair for me, please. Lauren has a few moles noted on her back, and here's the scar. The scar is approximately 1 centimeter by about a half a centimeter, where she had that mole removed last year. And she has a couple more moles down here, but all the borders are regular, color is regular. Lauren, do you wear sunscreen?
Yes.
Okay. And how often do you reapply?
Every couple hours.
Okay, good. Okay, one thing I'm going to ask you to do is take a nice deep breath in. Very good. And again. Okay. Okay, Lauren, I'm going to go ahead and listen. Take a nice deep breath in. In and out. Up your arm. Okay. Her lungs are clear. And Lauren, let's go ahead and have you turn to the front here. Okay. I'm going to listen to the front. So the first thing I'm going to do is, okay, nice deep breath in. And again. Okay. Chest rise is equal. Nice deep breath in. Very good. All right, I'm going to listen to your heart sounds as well. Okay. This is S1. Sorry, this was S2. And Erb's point. Tricuspid. And mitral. All right. And Lauren, I'm going to have you lay down, and I'm going to listen to them again with you laying down. And right now what I'm doing is looking at your chest for any heaves, any lifts. Everything looks pretty normal. And we do it with the bell. If you have a murmur, sometimes you can hear it better with the bell. Okay. Everything sounds good there. Okay, Lauren, now I have you laying in that position. I'm going to go ahead and I am going to come on the other side of the table. And I'm going to listen to your belly. First, I'm going to have you put your arms down. Looking at our abdomen, doesn't look like there's any lumps or bumps. I'm going to listen before I start touching. Okay. I'm listening for your bowel sounds. And one thing that I did not do earlier, but I have you laying here, I'm checking your axillary nodes. I'm sorry, I know you're ticklish. Axillary nodes. And then you have inguinal nodes down here as well as femoral pulses, okay? So I'm going to go ahead and feel those. And everything feels fine down there. Okay, now, Lauren, I am going to go ahead and I'm just going to do some light palpation. Feel any lumps or bumps. And I am going to feel for your liver. And if you think that you're going to be really ticklish, I'm going to just ask you to put your hand on top of mine, okay? And we'll do it together, okay? Okay. And now we're going to feel for your gallbladder. We're going to feel over here for your spleen, which we don't want to feel. If it were large, then I'd be worried. Okay, I don't feel it, so you're good. And your gallbladder is over here with your liver. Right now I'm going to see if I can try to catch a kidney. No. I'm going for your kidneys. No. Okay. Okay. Very good. You did it without laughing. I have you here. I'm going to feel your brachial arteries. And I'm going to feel for your radial arteries. Your pulses. Okay? Stay right there. Okay. All right, Lauren, I'm going to have you go ahead and I'm going to have you sit up. Okay, we're going to do your upper extremities. Okay, I'm going to have you slide here to the end of the table. Thank you. Okay, now I'd like you to bring your arms up for me and down, back down to your side and then back up and keep me from pulling your arms down. Keep me from pushing them up. Very good. And bring them forward and go ahead and flex your arms like you're making a muscle. Keep me from pulling. Keep me from pushing. Very good. I'm going to go ahead and check your elbows here. Very good. And we can go ahead and check the reflexes on there. And bring your arms back up here and go ahead and bring your arms back behind. Any pain at all in your shoulders? Okay. Any cracking? Okay, can you do it again with my hands on there? Okay, and back behind you. Very good. Okay, hands in front of you, and I think I'll bring you this way. Okay, Lauren, let me see you with your wrist. Bring it back. Okay. And push, pull, squeeze my fingers. Spread out your fingers. Keep me from pulling them. Very good. Good capillary refill. I don't see any lumps or bumps on her fingers. Come this way. Very good. Can you do this with your thumbs and your fingers? Very good. And her skin is nice and warm. It's dry. It's pink. And grips are strong. Let's see, Lauren. And I guess we can go on to your, one more thing. Do you feel this equally on both sides?
Yes.
You feel this equally on both sides?
Yes.
Do you feel this equally on both
yes.
sides? Do you feel this
yes.
equally on both sides? Okay. All right, I am going to have you lay back down, and I'm going to do a little bit with your lower extremities. Okay? Go ahead and lay your head down. Okay, we're going to do your lower extremities now. Lauren, if you could bring this leg up. Very good. And I'd like you to push against my hand. Very good. Pull up against my hand. Very good. Now we're going to do some eversion, inversion of your hip. Totally fine. Okay. And flexion and extension of the knee. Can you? I don't feel any cracking at all. Okay. And I have to do some abduction of the hip. And I'm going to come to the other side. Bring this leg up. Okay. push against my hand, Lauren. Push against this hand. No, push against this hand. Very good. Okay. We're going to and then adduction, abduction, and then of the knee. You know what, Lauren, it might be easier for me to do your knees if you sit up at the end of the table. Good job. And I'm going to go ahead and check your reflexes on your knees. And of your Achilles. Okay. Okay, Lauren. Extend and flex and push against this hand. Very good. Push against this hand. Good job. And push against this hand and push against this hand. Okay. Let's feel for any cracking. Nope. Very good. Move down to your feet. Okay. First thing I'd like you to do is bring your feet up towards my hand. And now down towards my hand again. There we go. Now I want you to pull back on my hands. Don't let me push your feet down. There you go. Don't let me push them up. Oh, good girl. And then can you move them in and out? And now push against my hands. Good girl. Push against my hands. Good job. And we're going to feel for your pulses. Fetal pulses are nice and strong. Cap refill is less than 2 seconds. Okay. And can you rotate your ankles around? Very good movement. And see how strong your toes are, Lauren. Can you push on my hands? Very good. Push on my hands. Good job. Okay. And can you fan out your toes at all? Good girl. Feet are cold. A little bit cold. Okay, let's have you hop down. We're going to have you do a little bit of walking heel to toe for me. So I'm going to have you turn in that direction. And heel to toe. And back. Very good. Okay, Lauren, I'm going to have you turn this way. The next thing we're going to do is take a look at your spine, but before we do that, I'm going to have you put your hands on your waist, and I'm going to have you turn to the left, and back to the front, and turn to your right. Good job. Now, stand straight ahead and bring arms down at the side, and I want you to lean back. That's pretty good. Now lean forward. Okay, and I'm going to have you go ahead down to your toes, nice and slow. Right now I'm checking you for what we call scoliosis. No curvature to the spine, no abnormal curvature to the spine. Nice and straight. Stay there. I'm going to come around and look at you from the front. Okay. And I'd like you to come up slow, Lauren. Very good. Turn this way. All the way around. I'm looking at where her scapula falls nice and even, bilaterally. Okay, now, Lauren, what I'd like you to do is stand on one foot and stand on your other foot. There's no fall to the hips at all. So Trendelenburg is totally fine. Okay, I think we've got everything. Oh, and hop on one foot. And hop on the other foot. And that's it. Thank you.